Hi friends, I'm Andrea Rajendran, one of the faculties from Blessing Institute Sharjah, and today we'll be here to explain you some questions related with the Sharjah noise. And as all you know, the RN nurses examination and PN nurses examinations are different, and they will get different questions, but the number of questions always will be 100. And today we will discuss some questions from RN, and it is important topics too. And I will discuss the topics firstly, then give a hint regarding the questions that you can expect from each topic. So one of the important one you can expect it is BPH, benign prostatic hyperplasia. So from the causes, assessment factor, diagnosis and intervention. So these are the categories you can expect question, and today I will discuss few questions from BPH. So one is regarding its related with the causes or the risk factor. So they have asked recently regarding the age group of BPH. So usually it is seen after the age of 60, but in March they are asking the age risk group start from 54. So it will be a question. Then second question we can expect from the BPH, it is from the nursing intervention. So many are there, but today I will explain you one, and it is from the nursing intervention. So regarding the continuous bladder irrigation, so some descriptions they are giving, and the nursing priority will come under continuous bladder irrigation associated with the surgical management of BPH. It is TURP, transurethral resection of prostate. So the nurses are needs to assess the bladder irrigation, especially the color change, red to pale pink. So this is another question you can expect from BPH. Then gradually they will ask something regarding the definition. So most of the questions you can expect from the definition. I think in a sample paper, mostly they will ask you 4 or 5 definitions. So one of them we will discuss today regarding abdominal lining inflammation. So exactly it is peritonitis, and sometimes they will describe the question as definitions, especially like this inflammation of the abdominal lining, it is called dash. And sometimes they will give the medical term like peritonitis and the definition, what is it is. So likewise the questions are there. So you have to choose the definition from the options. So as I told you, you will get a question like a definition. Sometimes the keyword will be there in the question, so you have to choose the definition, or otherwise they will give you a description regarding the definition as a question, and you have to choose the one word from the option. So one of them, it is peritonitis, inflammation of the abdominal lining. Then another topic, it is kinds of fracture. So from fracture, at least 5 or 6 questions will be there. From this, most important one, it is their types. So most important type means open fracture, green stick fracture and compound are important. And from this green stick fracture, sometimes they will give the description regarding the green stick fracture, and they will ask you what it is. Or otherwise, the commonest fracture which you can see in children, it is green stick. So this is one of the questions regarding fracture. And then one more I would like to explain you regarding the fracture. It's a complication regarding compartment syndrome. So not only for RN SSP, and also this compartment it is important, but in a different way they are explaining you, and sometimes the assessment factor will explain you more as a question, and one word you can choose for RNSS. Then the signs and symptoms they will ask you, and the management they are going to be asked from compartment syndrome. So most of the people will get questions from fracture. So I said the green stick fracture and compartment syndrome are the most important from fracture. So other questions also will be there, but they will discuss later. one more I will discuss you today. Some medications. So many medications they will be ask you, sometimes the medicine name, or sometimes the side effect, or sometimes education for the patient. So one of the medicine which they have asked regarding the name, they have asked it is seizure medication. So exactly they mentioned the status epilepticus medication. So really they mentioned it is lorazepam plus combination. So adjuvant therapy they have asked you. So here it is called as epi-1 plus phenobarbital. So you can see an option from the seizure medication or status epilepticus medication. It's exactly lorazepam plus phenobarbital. So other options also will be there, but the most effective medicine which is lorazepam plus an adjuvant, it is phenobarbital. So these are the few topics, and this will be helping for RN nurses to complete your exam. And the coming questions will be discussed in the next video. Thank you for listening me, and for any queries and other questions you can contact us, and it can be through WhatsApp or directly you can call, or otherwise you can meet here in the Sharjah as well as in Kottayam Bliss Academy. So thank you for watching me. See you again.